I think families should be allowed to visit 24/7 in the hospital, and here's why. I posted this as a controversial opinion I have as an ICU nurse, and a lot of you guys were like, I get it. And then the other half of you guys were like, hell nah, which I also understand. But let's just talk about this. There's actually been a lot of studies that have looked at 24/7 open visitation policies in ICUs and their effects on patients. There have been a lot of reported benefits, such as reducing frequency and duration of ICU delirium, improving patient satisfaction, enhancing family satisfaction with care. And we know that if we reduce delirium, then we also reduce hospital length of stay, ventilator days, mortality rates, etc. However, there is a downside to open visitation policies, and that is nursing staff or healthcare staff burnout. Major challenges that come with open visitations are that staff is just not totally happy with it. It can increase the workload, interruptions with care. People feel like they just have so much on their plate that they're kind of losing control of their day, which I also totally get. So I think there's got to be a balance, right? Like 24/7 doesn't mean like auntie twice removed should be coming in at 2 a.m. waking the patient up. But I do think it's better for the patient to have flexibility in visiting hours to allow the people that they know and love and trust and recognize to come and visit them. It also allows for the families to see the patients, talk with the nursing staff, physically see what is going on and how their loved one is being cared for, because I think it gets really tricky when visitors are out of state or someone doesn't have any visitors and all of a sudden we're talking about like, hey, end of life. One point in my ICU, we had visiting restrictions from like 10 to 6, which made it really difficult for people that work evenings or afternoons to get there at a reasonable time. I'm all for the flexibility in visiting hours. However, I do think there has to be some good communication and boundaries with families, especially if the patient is negatively affected by the family members. Patients need to be able to rest, and sometimes families can be very overstimulating. So I think that's where us as nurses and the healthcare team can come in and try and have a conversation with the family about, hey, love having you here to visit. However, the patient seems to be really agitated when you're here. So maybe we can like visit a little further, like take a step back, take a chair, sit in the room, like visit from afar. I know that always doesn't go over well, but you get the point here. So I'm curious what your visitation restrictions are in your ICU or whatever hospital setting you're in and how you perceive that. Let me know.